Now we have a brief overview of Carl Rogers' client-centered therapy, probably the most important development in U.S. Um, treatment of mental illness ever. So let's talk about Rogers. Here's a picture of Carl Rogers in his days at the University of Wisconsin. He grew up over the years to learn how to practice as a clinician, but had many experiences in the meantime. He and other humanists believe firmly in the potential of each person. That's what humanism is about. Grew up in the Midwest on a farm, very strict religious parents. Sick as a young man, deeply religious though. Graduated from the Union Theological Seminary in New York. Took classes with John Dewey, famous educator in the United States. Worked at the Child Guidance Institute in New York. Taught at University of Rochester, Ohio State, University of Chicago, and lastly at the University of Wisconsin. Worked at the USO during World War II. Moved to California and worked at the famous Western Behavioral Science Institute, which pioneered work in marriage and family. Lectured around the world and died in 1987. So the person-centered theory is sometimes called client-centered, person-centered, student-centered, and even non-directed therapy. But it has two broad assumptions. Before I go into those, just want to remind you that mental health treatment up to this time basically involved a person talking, the psychoanalytic approach, the therapist was passively absorbing things, making a comment once in a while, but really wasn't very involved. When Carl Rogers came along, that all changed dramatically. And he believed in two things: the formative tendency, which is that all matter, both organic and inorganic, evolve from simple to complex forms. Think about a child going from an infant to an adult. And actualizing form, the tendency that with all humans, and animals and plants as well, to move toward completion or fulfillment of potential. This was kind of based on Maslow's idea of reaching your full potential or wholeness. So those are critical. Some of the tendencies exist to provide maintenance, that is, going from day to day, while others are for enhancement of becoming all that you can be. Sometimes human actualization tendency is realized only under certain conditions. The person must be in a relationship with a partner who is congruent, it's super important, and authentic, and who develops empathy and unconditional positive regard. So what are those things? Well, congruent means more or less that you're on the same page and the person believes that you care about them. If you ever met someone who's phony or inauthentic, you know exactly what I'm talking about. It also means that the person has empathy, which is trying to understand where they're at in their life, not giving them sympathy, but a deep emotional understanding. And the last one is unconditional positive regard, which means that you accept them for right where they're at, good, bad, and otherwise, which sometimes can be very challenging. Having these qualities doesn't cause people to move toward a constructive personal change. It does, however, permit them to actualize their innate tendency towards self-fulfillment. So what the therapist is trying to do is remove roadblocks to growth. And you do that through the therapeutic relationship. Rogers believes that when congruence, unconditional positive regard, and empathy are present in a relationship, whether it's a therapeutic one or not, psychological growth is invariable. These are both necessary, you have to have them, and sufficient conditions for growth. As the individual develops a sense of self, they become more aware of I and me experiences. The person's self-concept is the individual's self-perception and their perception of their organismic self. This is explained more fully in the booklet, in the textbook. Dysfunction occurs when there are discrepancies between what you think you are and what you really are. The ideal self is the view that one wishes to be. So we all work toward that. Sometimes there's a discrepancy or incongruence between the ideal self and the self-concept. The person may or may not have awareness, and it can be through denial, or it could be ignored, or it can be accurately symbolized and freely admitted to the self structure, or it can be distorted. So you as a therapist is trying to help them clarify this and gain awareness, which is really difficult. How do you become a person? In fact, his most famous book is called On Becoming a Person. It's a classic book in psychology. Everyone should read it. The individual must make contact with the person, really connect with them. The individual develops a need to be loved and treated with positive regard, so accepted for what wrinkles and all. And finally, the individual must then develop a prizing or valuing of oneself called positive self-regard. And the therapist, through one way or the other, helps to facilitate this. So what are the barriers to psychological growth? Well, the condition of worth, that I'm only good if, or I'm only important if this happens. Incongruence between the self concept and the organismic self. Vulnerability occurs when we lack awareness of our incongruence. Everyone else sees it, but we don't. Anxiety occurs when we gain awareness and can be healthy. So anxiety is, for Rogers, was pushing you through this therapeutic process. Defensiveness is the protection of the self-concept against anxiety and threats by denying or distorting experiences inconsistent with them. Distortion may happen in more psychologically damaged people, like people that are psychotic. It's similar, but the misinterpretation of experience in order to fit into our self-concept. And of course, denial is refusal to perceive an experience in awareness or to keep some aspect of it from reaching symbolization. When defenses fail, the individual becomes psychotic or disorganized, which is more likely. So in psychotherapy, the client-centered approach holds that in order for a vulnerable or anxious person to grow psychologically, they must come in contact with a therapist who is congruent, who perceives them in an atmosphere that is unconditional acceptance and accurate empathy. If it's inaccurate, if it's unaccepting, if it's not congruent, it won't work. Having said that, this is not an easy task. A counselor must be congruent, which involves being aware of the feelings of the client, being aware of the client, and the expressions of what the client's talking about. Unconditional positive regard must be present. I mean, imagine if it's a little lady talking about her sadness versus a pedophile. I mean, those are very, very different things, but they both require unconditional positive regard. Empathic listening is the therapist accurately sensing the feelings of the client and are able to communicate with the client in an open way. Not fawning or saying yes to everything, but being accurate. And the therapeutic change is a process that occurs in stages. So it means that the person has to be aware that this is not an easy task and it takes time for this to happen. So Rogers turned the chair around, sat across from the client, and had a relationship, which is the foundation of what humanism is.